Good afternoon, everyone. I'm Mary Beth Marsden, and welcome to a very, very special edition of GBMC's Greater Living. I'm so excited today because for the next hour or so, we are going to get to appreciate, thank, surprise, and award some very special people. I mean, is there anyone else we've been more grateful for during this pandemic than nurses and all members of the nursing staff? I don't think so. And today we get to surprise some very special ones. And I am joined by two very special co-hosts that I'm so happy to have with me. So I'd like to introduce to you, and if you're from GBMC and you're watching, you already know them, I'm sure, but I'm joined by Dr. Joanne Ioannou, GBMC Senior Vice President of Patient Care Services and Chief Nursing Officer, and of course, Dr. John Chassar, President and CEO of GBMC HealthCare System. Thank you both so much for joining us.
Thank you.
I know for both of you, and I'm going to start with Dr. Chassar, this is such a special week. It's National Nurses Week. It's a time you get to thank nurses, really appreciate all that they've been doing. But here we are in this pandemic. We all have to distance from each other, so you are in your office.
Yeah, it's too bad, Mary Beth. This would have been the 5th annual Art of Nursing celebration. We normally do it at the CQ Arena. We're surrounded by all of our fabulous nurses, but it's COVID-19, so here I am in my office.
And Dr. Ioannou, this day in particular is incredibly special, so symbolic.
Today is the last day of the Nurses Week, May 12th, and we always do it on May 12th because it's Florence Nightingale's birthday, and today would have been her 200th birthday, so it's a very special day. And when you look at the World Health Organization already deemed the Year of the Nurse of 2020, how appropriate is it for us to celebrate Florence Nightingale, who modernized nursing, who was the pioneer in hospital infection prevention. She was a statistician, she was a researcher, she was an educator. She changed how we take care of our patients and made it very important that we continue to keep our environment clean so that we wouldn't spread disease or infection. And we need this most today, especially during this pandemic.
I can't help but think how proud she would be, if she were still alive, just to watch what's happening today. Dr. Chassar, what has made you proud of the nursing staff? This is such an easy question, but I think we're all proud of them, but you just have to be just so grateful for all of your people.
Absolutely, Mary Beth. Normally nurses are the backbone of the healthcare delivery system. And during COVID-19, they have really stepped up. They've put themselves right in the heat of battle. They've not worried about their own health. They've been right there to help others. And I had a conversation with some NSTs and nurses up in the MICU, the Medical Intensive Care Unit, last week, where they told me they were getting embarrassed with all the people from the community saying thank you, writing cards, bringing food. And I had to point out to them that the community takes them for granted at most times, but now the community is realizing how important nurses and nursing techs and CNAs and nurse practitioners are to the entire system, and they're finally getting their just due, their just recognition. So we're particularly proud of them this week, Nurses Week, during COVID-19.
Yeah, and I hope that feeling will continue. I think it will, because I feel like everything's changed, and I think we're going to look at the whole nursing profession in a completely different way now. Maybe much like we look at the teaching profession, because anyone who's teaching a kid at home right now knows how valuable a teacher is. Dr. Ioannou, let's talk about the nurses, and we're not just talking about nurses, RNs per se. This is a whole staff, a whole career with very many specialties.
That is correct. So during Nurses Week, we recognize nurses, of course, but we also recognize our nursing assistants, our certified nursing assistants, our nursing assistant support techs, our nurse practitioners. And, nurses throughout the organization have multiple skill sets. They're not just at the bedside. They're educators. They're in informatics. They are care managers. They work at Gilchrist. So we recognize everyone who's within the nursing team.
So Dr. Ioana and Dr. Chassar, you both talked about the art of nursing, and I haven't been to the event, but I've seen video of the event. I know we've covered it. Many news organizations have, and it's like the Oscars. I mean, everyone is like dressed to the nines. The nurses who are being honored and supporting the honorees are in gowns. It's really an incredible event. So we are trying to make today as incredible as we can during COVID-19. So just talk about what goes into the art of nursing, what the different awards are, how you do it.
So, as you stated, it is a huge event. It's about 800-person event that we have, and all disciplines come. So it's nursing staff, physicians, administrators, multiple people come to celebrate nursing that week. And we have seven awards that we give out. We have a subcommittee that meets early on. Anyone can nominate a staff member. That nominee goes to the subcommittee. We go through the criteria to make sure that it's an appropriate they meet the criteria in order to go forward, and then we narrow it down to the top three. And then the night of the Art of Nursing event is when we announce the winner. So there's a lot of hype. People get very excited, especially when you make it to the top three, and we feature each person. But the actual reveal is the night of the Art of Nursing. So it is kind of bittersweet because everybody was expecting it, but we didn't expect this to happen with COVID. So we really, as an organization, want our staff to feel special and know that we care about what they do. And so this is why we decided to do this virtually, but we're also very excited to do it today.
Yeah, I think it's wonderful. And Dr. Chassar, I mean, this was such a big night. It's such an important opportunity for you to greet these nurses and to thank them for their work all year long. So we made the best of it.
Yeah, Mary Beth, it's usually such a wonderful event. It's such a joyful time. I love walking around the event and seeing the looks on all the nurses' faces, see how happy they are to be together and to celebrate along with their colleagues. And I will particularly miss the opportunity to say thank you up on the stage directly to them.
Well, I think they know that you are thanking them, and I know in so many ways you've been working to get that message out. This is so fun. This is really the fun part of today's show, and that is we still have winners. You didn't want to not have winners just because there's a pandemic. We need to thank them now more than ever, but they don't know it. So talk about what we're about to do.
The organization was made aware that we had to postpone the Art of Nursing event. And then we all decided, well, we still had selected the winners pre-COVID. So we decided to come up with a process of having them come today. So what our staff think is what's going to happen today is that they're coming so I can interview them of how they're dealing with COVID as a nurse or a tech. And they think they're coming to answer a question that I'm going to interview them. They have no idea that after we ask them that question, that we are going to reveal that they won and that we are going to recognize them and celebrate them today. So we are very excited.
They're off in the green room, so to speak.
Yeah, they're in the green room.
They're distancing
nervous
from each other, and they've been told not to get on their phones because obviously we're live on Facebook right now. So they've been told not to really check in. And so they just think they're getting this question. It must seem very mysterious to them. So they're going to come out, and it's just going to be so interesting. So what's going to happen is most of the nominees or the awardees are going to come out, and we're going to ask them a generic question. A couple of them, one might be on the phone, and one has someone stepping in for them, but most of them are here and live. And then after that, we surprise them. So this is going to be a lot of fun. And if you're watching on Facebook right now, feel free just to send in comments and congratulations. I mean, I can't imagine anyone who deserves it more. Dr. Ioana, what do you say? Should we get going?
I say, let's do it.
All right. So we're going to call out our first nurse or member of the nursing staff. And joining us now, coming out on stage, you'll see her in just a moment, is Erin Campbell from Pediatrics. And she's going to come out and stand at the microphone next to Joanne. And we're going to talk a little bit about what she does.
Can you come up to the mic?
Yeah.
How are you?
Good, how are you?
Good to see you.
You too.
Hi, Erin. I'm over here remotely. It's so great to have you with us.
Hi, how are you?
I'm great, thank you. So thanks for being with us on Greater Living Live. Can you tell us a little bit about what you do in pediatrics?
In pediatrics, we take care of kids, but we also focus on taking care of and explaining things to their parents and their caregivers, making sure that they feel like their child was given the best care, making sure that they understand what's going on with their child, making sure that they leave the hospital feeling like they've been heard and feeling like their child's been taken care of in the best way.
How has it been during the pandemic?
Truly, during the pandemic, we try to explain things. It's been very difficult just because of the fear of it all and the parents not wanting to bring their children to the hospital because they don't want to expose them, but also here at GBMC, and I know a lot of other hospitals, there's one visitor policy. So whereas usually both parents can come in, they can ask all the questions that they want to ask and truly feel comfortable with leaving the hospital, they don't get that. So it's been a lot of explaining and education over the phone with the different family members and truly making sure that everybody feels like their child has been taken care of and they understand everything when they leave the hospital. And that's really been the target for my coworkers and the doctors who I work with.
Well, I think Dr. Ioannou and Dr. Chisar also have some questions for you or something to say to you.
I want to share with you what some of your colleagues wrote about you.
Okay.
Surprise. So, Erin is phenomenal. She is no nonsense, incredibly hardworking, smart, conscientious, and a highly skilled person who can get along with anyone. Day in and day out as a tech and now as a nurse, she has interacted with children of all ages and never fails to get a smile or a high five, but also to be appropriately stern. She has an uncanny ability to be serious when needed and silly when the situation calls for it, and somehow puts people at ease no matter the circumstance. She comes across as very knowledgeable, very caring, and very much in charge. It is not infrequent for us to have domestic violence situations on our unit, and I have watched Erin time and time again diffuse these situations with true empathy. People pick up on her compassion, but also listen to what she says, and they do what she instructs because she is earnest and honest. Very nice, isn't it?
Yeah, that's so sweet.
So, Erin, guess what? We have a
Dr.
huge
Chisar.
surprise for you. You are actually
God.
here because you are the winner of the 2020 Mrs. H. Norman Baetjer Nursing Graduate of the Year. Yay, Erin!
Thank you.
Yay! Congratulations and thank you for everything that you do for our patients, Erin.
Thank you.
So we have another thing to give you. Because it's Florence Nightingale's 200th birthday today, we're giving you a check for $200.
Good.
So congratulations. I'm sorry I can't hug you.
No, you're fine.
But I'm grateful for everything that you do
Thank you.
and what you have to deal with every day for our patients and their families and keeping them safe and yourself safe. So
Thank you so much.
congratulations.
Thank
Way
you.
to
You're
go,
welcome.
Erin.
Yeah, Erin.
Thank you.
Oh my gosh, that's great. So that's how it's going to go. So hopefully these recipients have no clue as to
Yeah.
what's happening, and Erin won't go back and tell them right now.
No, she's going to a separate room.
Yeah, and I think she was genuinely surprised. So that was pretty
Yeah.
awesome. Can you tell us a little bit about the award she received?
Mrs. Norman Baetjer Award is for the graduate who's a recent graduate who is acclimated into finishing her residency for the first year. So the Norman Baetjer Award goes to someone who has acclimated well, who has clinical excellence, and we honor that because Mrs. Baetjer, we have an endowed fund for our Center of Nursing Excellence, and we decided to develop an award for our new graduate nurses because they have to go through a year residency program, and then once they finish the program, then they begin moving up the clinical ladder. So that's how we came up with this award.
That's wonderful. And just so you know you don't have Facebook in front of you, but I'm getting sort of all these notifications. We have a lot of people watching, and I just want to go over some of the comments because people are so happy to congratulate the nurses that we have. We love our nurses. Maria writes, Debbie writes, this is great. Vanessa writes, Happy Nurses Week. Joe Hart, great work, and the winners are very deserving. Shannon writes, love her. That's talking about Erin. Always smiling and always helpful. So thank you so much for those comments. Keep them coming in, and hopefully we'll get those on during the show and continue to make our nurses and our nursing staff feel incredibly special. So Joanne, who are we honoring next?
Joining us now is Tina Rossier from GBMC Health Partners. Tina was unable to join us in person, so we have our chairman of pediatrics, Dr. Timothy Doran, who I'm trying to get him to come a little closer to me. No, right there. Stay where your mic is. And actually, we have Tina on the phone virtually. So Tina couldn't be here in person, but we have Dr. Doran, who is here, and he's holding his cell phone he's representing her. So thank you for being here, Dr. Doran.
You're welcome.
Hi, Dr. Doran. Hi, Tina. Can you hear me?
Tina, can you hear us?
I can hear you, yes.
Okay.
Okay.
Hi, Tina. How are you?
Hi, I'm good, thanks. How are you?
I'm good, thank you.
Hi, Tina. I'm Mary Beth Marsden. I know this is weird. We're all coming from different places, and you're on the phone.
So, Tina, can you tell us about your experience at GBMC displaying teamwork and how we deliver care?
I would have to say I experience teamwork every day at GBMC Pediatric Group. There really isn't one specific time that I can say that stands out over our everyday commitment to providing the best care for our patients. Dr. Doran and I have worked together for the past 20 years, and I would say that we are a very well-oiled machine. I can anticipate what he'll need ahead of time, therefore allowing him the time he needs for patient care. This in end makes the whole process much smoother for our patients and more efficient for the families. I guess I would say that our pediatric group is like a big family. We have each other's backs, and most importantly, we know how to have a lot of fun.
That's wonderful. Tina, thank you for sharing that. Some of your staff had written some wonderful comments about you that I'm going to read. And they say that your work ethic is unparalleled and you have an unflappably positive attitude. Your love of children and adolescents and organizational skills beyond anyone else with whom I've ever worked for. Our office is meticulously organized by Tina. She was born with lean management 5S in her DNA. She is meticulous in her work and always has a smile on her face. Patients ask for her all the time. Tina is always alert to worrisome signs when a patient is brought back and will notify one of the physicians if needed, so they can come see the patient urgently. She will call patients the next day to see how they are doing. Her impeccable responsibility and care for all patients sets her apart. Her clinical judgment is superb, and if there was ever an emergency, she would be the one who you would find with the right equipment, and she would always remain calm in a crisis. Tina is amazingly resilient despite facing major stressors in her life. She is remarkable in her love of her work. She is a gift to GBMC. So thank you, Tina, for what you do every day. I want to tell you, we brought you here because we wanted to interview you, but we also brought you here virtually, and Dr. Doran is your proxy, to let you know that you have won the Clinical Assistant Support Award for the outpatient area from the Art of Nursing. So congratulations, and Dr. Doran has your bouquet of flowers and your plaque. And I also want to tell you you're receiving another special gift. Today is Florence Nightingale's 200th birthday, and you will be receiving a check for $200 as well. So congratulations for everything that you do, and we're so grateful the way you care for your patients and as you would for your own loved ones. So wonderful job, wonderful. We're really grateful.
Oh my goodness, I had no idea. So this is spectacular. I'm kind of speechless, and I'm tearing up. So it was great to hear all those wonderful things said from my office. So I mean, I do love my job, and then immensely, and I love the people I work with.
I know, Tina. Thank you. You can cry now. So
I know. Thank you. I'm going outside on video.
thank you very much. Thank you, Dr. Doran, for joining us today. We appreciate it.
I just want to add that while Tina was talking, we were getting some comments on Facebook too, live, and here are some of them. Shannon writes, so exciting for them. She's talking about Tina and Aaron. This is awesome. Beth writes, way to go, Tina. Rachel writes, nice job, Tina. Shannon writes, congrats, Tina. Lisa writes, congratulations, Tina. So there's a lot of people watching on Facebook right now and a lot of support for all the nurses and all the technicians and everyone who's on the nursing staff. Another group that's so important, Dr. Chasar, and I know you wanted to talk with them, who support the art of nursing, and that's the Volunteer Auxiliary.
Absolutely. And first, Mary Beth, wow, 5S in Tina's DNA. Boy, I wish I had some of that DNA. So as you can see, this is not our traditional Art of Nursing event. I'm very appreciative for those coming together like Dr. Doran and Tina virtually. But I have to take this time to thank the GBMC Volunteer Auxiliary. Without the auxiliary, we would have not been able to do Art of Nursing over these 5 years. And I am so grateful. The whole GBMC family, is so grateful to the GBMC Volunteer Auxiliary for this fabulous support of our nursing staff.
It's great. We have to have support on all levels in the hospital to keep our nurses and the nursing staff just buoyed to be able to do the job that they do. We have another winner, and we have a whole list of them, but our next one is also very special, and I know Joanne's coming back to tell us more about her.
We're now going to honor Zonda White, and unfortunately she is not able to be with us today, but her nurse manager, Stephen Banco, is here to be here for and accept for Zonda. So thank you for being here.
Of course, glad to be here.
Steve is the nurse manager of Unit 38, which is also a dedicated COVID unit. So they have had their challenges as well, but they're doing well, aren't they?
Absolutely.
Yeah. So I'm going to share some words about Zonda, and this will be taped so she can see it in the future. So Zonda is wonderful not only with her skill set, but her kindness and compassion. She makes patients feel well cared for and safe. Recently, a patient confided that she had never spent the night in the hospital and was very frightened. After meeting Zonda, who was warm and inviting, she said, if this lady will be here all night, I will be okay. Zonda is a master at care and gets to know her patients in depth, which allows her to notice and report even minor changes very quickly. She has a way of putting people at ease with her big smile and her warm heart. Zonda truly cares for patients, and it shows through her joy and the pride she feels from her work. I am so disappointed that I was not able to share these words about Zonda at our annual Art of Nursing event. However, I am pleased to announce that Zonda White has won this year's Inpatient Clinical Assistant Award for this year's Art of Nursing. So congratulations to Zonda and to your unit, and thank you so much for being here to receive her award.
Of course, it's an honor to receive it for.
And Dr. Chisara has some other words for you.
Yes, and Steve, congratulations to Zonda. Zonda will also be receiving $200 in honor of Florence Nightingale's 200th birthday. And Steve, thank you so much for accepting this award on her behalf. And thank you to Unit 38. And by the way, Steve, I really like your hairstyle.
Thank you.
Wait, I want to see it again. All right, there we go.
Yeah.
Easy to take care of.
You,
You don't have to
Steve.
worry about the hairdresser that none of us have been able to see for the last 2 months. Thank you so much. And Dr. Chasar, let's just, Steve, Zonda, they're on the front lines. Can you just talk about really what life has been like for them?
It's been very difficult. People didn't know what to expect as the pandemic hit us, and they stood up. They stood tall. Everybody's needs have been met. Unit 38 was a COVID-19 unit early on in the pandemic. We had to switch them over to regular medical care, and now we're switching them back. And we're so delighted that staff is willing to roll with the punches and do whatever it is that the community needs them to do.
Do you feel like the hospital has never had to be more flexible than it is now?
Oh, absolutely, Mary Beth. There has never been a time where we didn't know what was going to happen day to day. I'm so proud of each and every one of them.
So are we. Thank you so much. We're so glad that they're all here in our hometown. We have another winner, and before I say winner, I don't want her to come out and hear me, but Dr. Ioana, she's here? Oh, well, she's a winner because she's appearing on Greater Living, and everyone who's a guest on Greater Living is a winner. So we'll let you take it away.
So talk about flexibility. So we just had Unit 38, as Dr. Chassar stated, was a COVID unit and then has gone back to its historical ways of doing business. And now we have Ariel, who is here, Ariel Masafi, who's from Unit 48. 48 is currently a COVID unit. So in terms of flexibility, as you can see, we change operations day to day depending on our needs. So how are you, Ariel?
Doing well.
You're doing well? I'm good, thank you. So Ariel, actually, Dr. Chassar.
Well, I'd love to ask Ariel how it's been, what it's been like to kind of, have to switch over, have to now be, the pandemic, the COVID unit. Tell us about it.
So it's definitely been an adjustment, an absolute learning experience, but it's also been very humbling. Patients are putting faith in us to essentially, in some ways, have put their lives in our hands. So it's very humbling in that regard. It's also been very challenging because we're learning more and more about the virus on a daily basis. So we're trying to keep up with it, and we're trying to improve patient outcomes in the best ways possible.
I'm sure in the beginning, I would imagine that because it was such an unknown, there was so many nerves about it. And now do you feel like you're just sort of getting a better handle on how this goes?
Yeah, absolutely. Definitely a lot more nerves in the beginning, but now as we've adjusted to the sort of new normal, so to speak, I do feel like we have a better handle on it. We're able to, we know the symptoms to look out for when patients might begin to rapidly decline, as we have seen with this virus. So we're definitely more knowledgeable now, which helps and makes us more comfortable as healthcare workers.
Thank you for coming and answering our interview questions, but I also want to share some comments that your peers wrote about you. You and your teammates on Unit 48 are clearly going through a lot, especially from switching from surgical to COVID, so we're very grateful for that. But I also heard a lot about your evidence-based practice project that you did with Carol Corbin. Mm-hmm. And I understand you studied probiotics and through collaboration with several departments at GBMC, including infectious disease, antibiotic stewardship, and pharmacy, as well as a literature review and analysis, GBMC has made changes in its formulary just from your practice, which is awesome. Your ability to engage stakeholders, present at the Antibiotic Stewardship Committee, and complete your requirements for transition to practice within your first year of being a nurse is incredibly impressive. You should be very proud of that. You are both role models who demonstrate the effectiveness of having a questioning attitude. So because of this, you and Carol have won the Evidence-Based Practice Award in this year's Art of Nursing event. So you want to turn around?
Thank you. That's tremendous.
Congratulations. I guess you didn't expect that.
Thank you. We couldn't have done it without all of the team.
Dr. Chassar is going to tell you what else you're receiving.
And Ariel, I am so proud of you, and I think it's really amazing at this young stage of your career that you can say that you're becoming an expert in the care of COVID-19 patients. That is just marvelous. Thank you so much. So I want to also tell you that you have won $200 in honor of Florence Nightingale's 200th birthday. So congratulations.
Thank
Congratulations.
you so much. I really
Good for you.
appreciate it.
You're welcome. Thank you for coming. Thank you for all that you do and keeping yourself and others and our patients safe. Thank you.
Thank you. It's my pleasure.
Ariel, thank you so much. And we're getting all these people who are writing into Facebook and also congratulating you. Becky writes, congratulations. Debbie, way to go. This is for Zonda because we're a little bit delayed, but Zonda was the last winner and wishing her congratulations. Maria writes, so exciting to do this virtually. It isn't the night at CQ. It isn't a big gala, but it is still an effort to appreciate and to say thank you. And everyone's just doing the best they can, and I think everyone realizes that. Maria, so proud of these winners. Beth writes, this virtual experience is wonderful. Kudos to whoever came up with this. And Judy writes, she's watching, and thumbs up and hearts. And thank you all so much. And we have many more people to talk to.
So we actually we're going to welcome back. This is Carol Corbin. Hi, Carol. How are you? Good to see you. She is also a nurse on Unit 48.
Hi, Carol. It's Mary Beth Marsden. How are you?
Good. How are you?
I'm fine, thanks. Can you tell us about Unit 48 and your experience these days?
There's a lot of changes, and we are constantly trying to do the best we can with all the COVID patient that we have in our unit, and it's a big adjustment. Definitely a big adjustment.
I bet it is.
Yeah.
Can you just, in very broad terms, what you love about nursing, and it maybe especially now, or maybe you find it especially challenging now?
What love about nursing at GBMC? It allows you to grow professionally as a nurse by helping new nurses to reach their highest potential, and with the support and guidance of my unit family, my manager, and the nurse educators. I think without them, I will not be where I am today.
Well, we're glad you are where you are today. Thank you.
Thank you.
So it's really wonderful to hear you say that, and you talk about your team and as a family and so forth. But I really appreciate the work that you do here every day. I wanted to tell you that Ariel Masafi and yourself, you did an evidence-based practice.
Yes.
And I understand you presented your findings at the antibiotic stewardship meeting.
Yes.
And you completed your requirements for from transition to practice within your first year of being nurses, which is amazing because that's a lot of work. And as a result of your work, GBMC has changes in our probiotics formularies, which is huge. And that's very impressive work to do in such a short time, and being, working every day and then taking the extra step to do this evidence-based practice work. So I'm really grateful for that.
Thank you so much.
So you and Ari are clearly role models and demonstrate the effectiveness of having a questioning attitude. So we're really grateful for that. So we brought you here because we wanted to interview you and see how you're doing with COVID. But we also wanted to tell you that you're the winner for the Evidence-Based Practice Award for the Art of Nursing. So we have flowers and a plaque for you.
Woo!
And we can't do Art of Nursing this year, but we did it virtually. So we really wanted to surprise you and tell you that you won the award from your doing your evidence-based practice project. And Dr. Chisar also has something that he wants to share with you.
Hi, Carol. Thank you so much for your flexibility, your fabulous work on Unit 48, both as a surgical nurse and now as a COVID-19 expert. Thank you so much. And as a recognition, in recognition of Florence Nightingale's 200th birthday, we also want to present you with a check for $200. Congratulations.
Oh, wow. Thank you.
So congratulations.
Thank you.
So we have her manager, Kim, here taking pictures of her as well.
Yay,
congratulating
as
her.
she
So Kim,
should.
thank you for coming.
And we're getting a bunch of people on Facebook too who want to congratulate her, but they can't be there, so they're doing it this way. Beth says, nice job, Carol. Tasha, Carol, yay, so proud of you. Anna Marie says, way to go. Ariel, congratulations and thank you for all you do. Shannon writes, incredible job, Carol. Molly writes, many thanks to all the GBMC nurses and your contributions to health. Congratulations. And Voila writes, thank you to everyone on Unit 38 and 48. You are amazing. The best care was given to my mother-in-law and dad. Congratulations and thank you. So thank you so much for joining us on Facebook Live and sending these well wishes to the people who are joining us today. And we're not done yet, isn't that right?
No, we're not. So here we have now is Jessie Varghese. If you could come up to the microphone and to that one, right? Perfect. And Jessie is a registered nurse who works in our general operating room.
Hey, Jessie, how are you?
I'm good.
So Mary Beth Marsden is also with us, and Dr.
Hey.
Chassar.
So I was just wondering why you chose the general operating room, and what are your favorite parts about working in the OR?
I have been working in GBMC at 22 years, and my coworkers are very good, and the David's community is my.
It's okay.
Yeah, it's okay.
It's okay.
So you really
It's
appreciate
true.
your community and your coworkers, and I guess you must like that sort of environment too. I mean, it's
Yes, I like that my supervisors and managers are very helpful when I need a help.
Well,
They
22
all
years.
step in my.
That's amazing. So you're really part of the family.
Yeah, GBMC is my second family.
That's wonderful. And
After my
Dr.
family, GBMC is my
Yeah,
family.
so I'm sure you've seen Dr. Ioano over the years, right?
Quite a few times.
You don't have to tell us any stories.
Yeah.
So thank you for coming to answer our questions today, because we're really interested in how our staff are doing with COVID, and we know it's a stressful time. But I also wanted to share some comments that your peers wrote about you. They say, Jessie goes out of her way to help anyone. She will mop the floor if that's what's needed to be done in the moment. She always is assisting other nurses by putting back excess supplies and equipment. She does these types of things without being asked because it helps others and creates a feeling of camaraderie. Jessie is objective and fair when assessing situations, always listening to all sides and asking questions before commenting. In addition to always assisting others, she consistently thanks others, and it makes people feel good to be appreciated. Jessie teaches the people on her unit about her culture, which is helpful when taking care of patients who come in who also share this culture. Jessie is a great nurse. She always gives 100% of herself to everyone equally. There is not a person in the GOR that Jessie hasn't helped. So thank you. So one of the reasons, as I said, you came in today so we can interview you. But we also wanted to honor you. So we usually have the Art of Nursing every year, but we couldn't do it this year. And you were one of the nominees for diversity in nursing. And I'm proud to say you're the winner this year.
Thank you so much.
So congratulations. You might want to
Thank you.
turn around because you have a couple gifts.
Thank you so much.
You're welcome.
Thanks.
So
Yes, and hi, Jessie.
So Dr. Chassar has another message for you. So we wanted to say congratulations on your winning the award.
Yeah, and I want to thank you for your fabulous years with us in the GOR, and thank you for all you've done for our patients. It must be fabulous for you to think about all the people you helped, and we want to tell you that you've won $200 in honor of Florence Nightingale's 200th birthday. So congratulations, yay!
Congratulations,
Thank you
Jessie.
for having me here. Thank you.
You're welcome. Thank you.
Thank you.
That's great. And while Jessie can still hear me over the mic, and she's accepting her congratulations in person, I just want her to hear that people are writing in on Facebook. Connie writes, Jessie, Jessie, Jessie. And Niambi says, yay, Jessie. And Barbara writes, congratulations to all of you for such committed work. Shannon writes, awesome work coming from the new nurses too, and the nurses who've been there for 22 years. Great work. Thanks so much, Ariel and Carol, and to Jessie. And we're getting a lot of thumbs up emojis and a lot of smiley faces and a lot of hearts. And they keep coming in. I'm getting all these screenshots. So Shannon sends a bunch of hearts. Stephanie says, you're the best and the sweetest. Ma Tyne writes, congratulations to all the nurses at GBMC. So proud of all of you. Jessie is awesome. Isn't it fun? Are you guys having fun?
Totally. Yes, we're having a great time.
Yeah, I'm having a great time.
We're not serving dinner, and there's not like a big dance floor or anything, but I mean, it's all right, right? So Dr. Ioana, there's something I know that you wanted to talk about, and that was the Women's Hospital Foundation. Super important to GBMC, and I think there's a challenge grant to talk about. Is that right?
Yes, it's a challenge grant. So the Women's Hospital Foundation is a huge supporter of GBMC's Center of Nursing Excellence and Education, and this is their second year where they have asked us to perform and be a part of the challenge grant because they help raise money and funds for our continuing ed. And I'm happy to say that we have met that goal. We met it last year, and that we're so grateful that they support us throughout our ventures and what our programs are. And they're a huge, huge partner to us, and we're incredibly grateful to the Women's Hospital Foundation. So thank you.
That is wonderful. And we have 3 more people to interview, and I think our next person, I'm told, has been very calm through this whole process.
Yes, very calm. Miss Yvonne Latshaw is here, so thank you so much for joining us.
Thank you for having me.
How are you?
Doing well, thank you. How are you?
Good. You want to get a little closer to the mic?
Sure.
Good. I just want to make sure everybody can hear you.
Okay.
Hey, Yvonne, so nice to meet you.
Hi, nice to meet you too.
Hi, thanks so much for joining us. So you are a care manager with GBMC Health Partners, and can you tell me what that's all about?
As an RN care manager in an ambulatory primary care setting, I work with the providers in the office to help manage and care plan our high-risk patients, which includes our patients with uncontrolled diabetes, uncontrolled hypertension, and also our patients with behavioral health conditions. I also outreach to our patients who have been admitted to the hospital for transition of care. We want to reach out to our patients, set up their appointment with their primary care doctor, review their medications, answer any questions that they may have. And also, we want to identify any barriers to care that they may have. During the COVID-19 pandemic, we want to continue our work in outreaching to our high-risk patients and our transition of care patients. But instead of encouraging our patients to come into the office, we're now offering virtual visits for the patients. We want to make sure that we continue to outreach to our patients that are high risk, to make them understand that if their chronic conditions are not well controlled, it puts them at a higher risk for developing complications. So we've partnered with the Geckel Diabetes and Nutrition Center to set up virtual visits with them to continue with the diabetes and nutrition education. We've also partnered with Lorianne Telehealth and Gilcrest for remote patient blood pressure monitoring. Over the years, I've developed strong relationships with our patients at Hunt Manor, and I just want to let them know that we're still here for them during this pandemic. We have virtual visits that are offered to them, and if the patients need to come into the office, we want to reassure our patients that we are taking all the protective measures to keep them healthy and safe.
Wow. During this time, you are indeed a lifeline for these patients. Thank you so much.
Thank you.
And I think Dr. Ioana has some things to say too.
I do. I think, first of all, thank you for coming in and answering our questions, because we're very curious of how our staff are doing from the entire system of dealing with COVID. So hearing what you're doing for our patients and their families and reaching out to them, we're incredibly grateful, and thank you for continuing to do that. But there's also another thing we want to talk to you about today. So I have here some comments that your coworkers have written about you. So I'm going to take the time to read it to you, okay? Yvonne has worked for GBMC for over 20 years. Her dedication to this community is exceptional. She's an integral leader of patient-centered care. GBMC has benefited greatly from her work. She works with Gilcrest Elder Medical Care at Home to transition patients to a new model of healthcare, which is patient-centric, and has been instrumental in working on a committee to support lower A1Cs for diabetic patients. She managed our office to lower hemoglobin A1Cs in our diabetic patients. She has helped improve our standard work throughout the whole organization. She also helped to develop a report and standard work to get diabetic patients into dietary education with the Geckel Center. Your peers say you're an exceptional care manager. Exceptional. We are happy to report to you today that you are the winner of the Art of Nursing Patient-Centered Care Award. So congratulations.
Thank you.
You're so welcome.
Thank you. It is my pleasure. Oh, thank you. Oh,
And
thank you
Yvonne,
very
this
much.
You're welcome. So don't go anywhere yet. Dr. Chisar has a few words he wants to give you. So see, isn't it a nice surprise?
It is a nice surprise.
Now you can take a deep breath.
Now I can breathe.
Hi, Yvonne. I could listen to your stories about the work you're doing as care manager all afternoon. You are part of what makes GBMC different. You know, our core competency is redesigning care, and in about 2 minutes, you gave us about 8 examples of how we are redesigning care to make it the way we want it for our own loved ones. So I'm so proud of you and so grateful. And an added surprise, you have won $200 in honor of Florence Nightingale's 200th birthday. Yay, Yvonne!
Congratulations.
Thank you, Suzanne. I want to hug you.
So thank you for all that you do and for keeping yourself and others safe and making sure that our patients continue to do well during this pandemic. So thank you and congratulations
Thank you.
again. You're
It's
welcome.
My pleasure. Thank you.
Thank you so much, Yvonne. It's just wonderful. And I think we actually have a video to show you of some of the great staff at GBMC and their faces, and something we usually show during the Art of Nursing, but we're going to do it now. If you're just joining us on Facebook Live, we are talking with many of the nurses and nurse practitioners and technicians who are at GBMC, who are working on the front lines right now during this pandemic. And we're just taking some time to honor them in a very interesting, special way. But I don't want to spoil it for you because our next guest is with us now.
So we have Katherine Mauriello here with us.
Kathy, thanks so much for being with us. Can you talk about a recent experience I'm told that you had where you made a positive impact on a patient, a family, or a coworker?
As a palliative specialist, part of what we do is help bring the person into what's going on medically. With that, we're often engaging with families as well as the patient. In the current climate, with the restrictions and isolation, this has been a challenge. We've been able to use video platforms to help connect patients with their loved ones, sometimes seeing each other for the first time in weeks. And I think that's been a really meaningful experience for everyone involved.
I can't even imagine how challenging that can be for families during this time, because the one thing you want to do is touch each other.
Right.
So you've had to probably go above and beyond to sort of bridge that gap for them.
Yeah, they're holding a patient's hand with my hand, showing my hand and the patient to the family with a phone or an iPad to try and help make those connections is very powerful.
So important. Thank you for that.
I also want to share some comments that your peers have said about you. So Kathy is the first to raise a hand to help, no matter what the care setting, no matter what the circumstance. She inspires the people around her, patients, families, and colleagues, toward positive change just being present. Her compassion, passion, and her ability to see the big picture is infectious to those she works with and encounters each day. She truly leaves her heart at the table, whether dealing with her colleagues or her patients. As a mentor, Kathy shines in all settings with nothing but praise of how patient understanding and knowledge she is of her work. Her low-key manner and calming presence allow for the best environments to learn and care for patients. Kathy is one of few nurse practitioners certified in hospice and palliative care. This is not a requirement of the job. She did this on her own. Kathy is an advocate for the field of palliative care. Given any opportunity, she will share her passion and her knowledge, bringing further awareness to all the work she touches. It's wonderful. And thank you for, especially during this pandemic and COVID, with everything that people and their families are going through. We need people like you more than ever. This is not the only reason why we brought you here today, to tell you, because we have not had the ability to do Art of Nursing and Seek Your Arena. So I'm happy to tell you, you won the Nurse Leader Award this year.
Yay!
So congratulations.
Thank you.
You're so welcome. Well deserving. And we're very, very grateful for what you're doing for our patients and their families during this difficult time. And actually, Dr. Chassar has other information that he wants to give you.
Thank
Kathy.
you.
I really want to thank you for being there at the bedside, especially in these difficult times for families. I think that story is just emblematic of why GBMC and Gilchrist are here. So thank you so much. And we have a special prize for you. You've also won $200 in honor of Florence Nightingale's 200th birthday. So congratulations.
Yay!
Congratulations.
Thank you. This is a huge honor and unexpected. Thank you very much.
You're welcome. Thank you. Well deserved. Congratulations.
Thank you so much, Kathy. And Kathy, as you were getting that award, we had people writing in on Facebook to congratulate you and also the other staff members who won. Woohoo, Kathy, you're the best. This was Tawana who wrote. Anna Marie says, congratulations. We are grateful you are on our team. That was to Yvonne. And Elaine Campbell writes, I am so proud of my granddaughter, Erin Campbell. She was our first recipient today. Thank you for recognizing nurses for all the work they do, especially in these difficult times. And Dr. Ioano and Dr. Chassar, I hearing that story, and I know, Dr. Chassar, you brought it up too, but just people are in hospice, they're getting palliative care. This is such a highly emotional time for any family, and this pandemic has made it so difficult for them to connect during this time when they almost need each other more than ever. And so to hear stories like Kathy's and how she's going above and beyond and trying to think of ways that she can keep them connected is pretty amazing.
It certainly is, Mary Beth. 75% of Americans say if given the choice, they would prefer to die at home surrounded by their loved ones. And every day in the middle of this COVID pandemic, Gilchrist nurses and support staff and geriatricians are going into people's homes to be there for them. And when these patients wind up in the hospital or even in the Gilchrist inpatient setting, because of the pandemic, we cannot have visitors coming in and putting themselves at risk. So we are so grateful to people like Kathy for being able, as you said, to bridge that gap and to help people have that connection.
To give you a little bit of what happens on the hospital side when the families can't come in, we have nurses, our chaplains, others being with the patient. And thank God we have technology where they can see their loved ones, but we do have our clinicians and staff there holding our patients' hands, which we thought never we'd be in this situation or have to do that. But thank God that we are able to do that and provide some support for our patients and their families.
And can I just add to that how difficult that must be? Because is there anyone busier than a nurse or a member of the nursing staff during any given day? And so the amount of patience and effort that takes, and to still do the job that's so important at the same time, is pretty amazing too.
It is. It is. But emotional support is equally important as giving a medication or doing a test when you're providing care for your patients.
And I think we have another nurse joining us now.
Yes, we do. So we have Teresa Breitenbach. Can you come on up to the microphone? How are you, Teresa?
Good. How are you?
Good. It's great to see you.
You too.
Thanks for coming in today.
Can you just tell us a little bit about what it means to you to be a nurse at GBMC?
Being a nurse here is so much more than just caring for my patient the best I can. It's about forming bonds and relationships with the families of our patients. Many of them are with us for weeks, if not months at a time. So you're supporting them, educating them, helping them to feel confident in their abilities to take care of their babies both here and after discharge. It's also about being part of a team where everyone is respected and valued, and you're encouraged to voice your opinion and give input into the plan of care. And then also just to feel supported by my coworkers, and then also managers and upper management, where I want to grow, take on new responsibilities, and just have new opportunities here at the hospital.
Well, Teresa, no doubt your work has been not only noticed, but greatly appreciated.
Thank you.
And Dr. Iowano, I think, has a few things to say about that, too.
So thank you for coming in and answering our questions. We are asking staff how they're doing, especially during COVID. You know, this is Nurses Week. We want to recognize nurses. But I want to share some comments that your peers have said about you. Okay. So Teresa is the epitome of what it means to be a positive collaborator and mentor at GBMC. While a staff NICU RN, Teresa was consistently utilized as a mentor. With her neonatal and pediatric background, it became clear that Teresa's excellent leadership and clinical skills, as well as her ability to educate others, could be utilized amongst the entire pediatric division. Having Teresa in the maternal child health resource nurse role has directly impacted patient safety, experience, and overall quality of care. Her peers call on her to assist when they are faced with challenging clinical skills or skills that are low volume, high risk. Her expertise and calm demeanor allows for optimal learning for her colleagues. Her work in engaging staff and breaking down silos between 3 separate units allows for further collaboration to provide optimal care for neonates. Teresa displays the utmost compassionate care for each of her patients and colleagues. Her presence has had a tremendous impact on everyone in maternal child health. So thank you for everything that you do.
Thank you.
And we are grateful, especially for our little babies and dealing with the babies, but not also the babies, but the parents. And it's a very stressful time. So not only are we here to talk about the questions that you answered, we're also here to tell you, she's got this look on her face, that you have won the Clinician of the Year award for the Art of Nursing.
Thank you.
So congratulations. We couldn't do it at the CQ Arena this year because of COVID, so we decided to do this virtually. So we wanted to surprise you and say, I can tell, congratulations winning the Clinician of the Year award. It's wonderful.
Thank you so much.
Also want to thank you. You have also won $200 in honor of Florence Nightingale's 200th birthday. So great work and congratulations.
Thank you so much.
Well deserved, and thank you for all that you do.
I love what I do.
That's wonderful. Thank you.
Thank you so much.
You're welcome.
Thank you, Teresa, so much. And Teresa, a lot of fans on Facebook right now, so I'm just going to read a couple of the comments. Joanne writes, Florence Nightingale is shining down on all the amazing nurses and healthcare professionals. She would be extremely proud, especially during this difficult COVID-19 pandemic. Bravo. And Maria writes, Teresa Breitenbach is an outstanding nurse. This is well-deserved. We love her in the NICU and in all of the maternal child health. So proud. She is one of the best. Woohoo. Maria writes, so thrilled for you, Teresa. Nicole writes, congratulations, Teresa. And on. There's more and more, but we might run out of time. So that is just great. So we've really highlighted some of the best and brightest that are working right there at GBMC and continue to do such a great job.
Yes, we do. Thank you, Teresa.
Very proud, Mary Beth, and thank you.
Thank you, Mary Beth, for helping us do this today. It means a lot to the staff and GBMC. We're very grateful that you took the time to honor our nurses and our nursing staff. It's an amazing thing to be able to watch and also to provide some joy when they're faced with stress every day dealing with COVID and non-COVID. So we really appreciate you partnering with us today.
Well, it's the very least I can do. I appreciate the fact that you guys thought outside the box. You didn't have to cancel the event altogether. You really wanted to take the time to honor these hard and dedicated workers for what they're doing, especially during this time. So kudos all around, and I'm glad for all the people who watched on Facebook and were so happy for their colleagues and who wrote in and told them so. So it was just really great. And we want to leave you today with some more faces of the nursing staff at GBMC and wish everyone good health, stay safe, and we'll see you next time.